What's up, citizens, and welcome back to the Leo Dotson Show. Today we're looking at a three-part series on healthcare in the United States. And the first section, part one, pretty well named, I think, part one, the first section. It's actually going to be a quick backdrop of what's going on in the U.S. healthcare industry. The next section, part two, will be a very objective look at the pros and cons of Affordable Care Act, ACA, otherwise known as Obamacare. It's important to keep in mind that a lot of Democrats are going to be for Obamacare simply because a Democrat pushed it through. Likewise, a lot of Republicans are going to be 100% against Obamacare because a Democrat pushed it through. And the Leo Dotson Show, we want to rise above partisan politics and look at it as this a good thing, a bad thing, or something in between for the American people? And that's the approach that we're going to take when we do our analyses of it. And on the third section of the healthcare series, we'll be looking at the constitutionality. As many of you are aware, the Supreme Court reviewed in March and will be making a decision in June of 2012 on the constitutionality of the mandate portion of Obamacare, as well as the severability of whether it can exist with or without the mandate. And we'll cover all of that in the next two sections. But let's go ahead and get started with the first section. The first section, we want to look at the healthcare industry. If we have a backdrop, if we go back to 1980, the United States had the #1 quality healthcare in the world and at a reasonable cost. And if we flash forward today, we've really gotten ourselves into a mess. We're no longer #1 in quality. We've dropped to 37th in the world and falling. And in certain categories, we're even worse. We are the #1 worst obese nation on planet Earth. We rank 50th in longevity. And some would say not only in length of life, but also quality of life in the industrialized world. And we rank 46th in infant mortality rates. We literally have the worst longevity and the worst infant mortality rates of any country in the civilized world. You know, what's happened? The costs have skyrocketed, our quality is plummeting. Like any scenario of this magnitude, it's not any one thing that happened. It's a collection of bad scenarios and factors creating a train wreck or a perfect storm, if you will, that's gotten us into this mess. I think first off, we look at the insurance companies, the health insurance companies. First of all, look at the claims process. One of the things that, and it's very cumbersome, it's very difficult, adds to a lot of cost, much of it is outdated, and then the policies are pretty horrible in terms of customer service. Basically, many insurance companies will have a policy of denying whether it's a legitimate claim or not 3 times in hopes of making policyholders get so frustrated that they just give up on their claims and go away, which makes more profit for the health insurance companies, but creates a healthcare system that's fraught with increased cost and just a bad system all the way around for the users of that system. I think another thing are the territories. If you think about if you and I wanted to buy auto insurance or life insurance, other types of insurance, homeowners insurance, we can shop around to find the best deal for us in whatever state that might be located in. So why is it that we have essentially government-sponsored monopolies, or at least oligopolies, territories? I mean, if I live in New York, I have to buy health insurance from a company that's based in the New York area. If you live in California, you have to buy health insurance there. Why is that? If we opened it up to interstate commerce, where there was competition or an entrepreneurial fair playing field, the free markets would take over, and we would at least get better rates and more competition, and that usually solves a lot of problems. But again, that's only part of the problem. Another thing are the free riders. Unlike other things where you have to pay for it as you go, you can't walk into an into an emergency room and get long-term health care. But you can walk in if you've been in an acute injury or a car wreck or something that's happened immediately. You can go in and get urgent care treatment for free. Now, it's not free. That person may not pay for it, but it has to be paid for by someone. And what happens is those people who are in the system that are paying into it end up having to pay more to cover the cost of those people who receive health care benefits yet don't contribute to the cost of those benefits. And that also helps skyrocket cost and reduce quality. I think another thing, if you look at the other countries that are far ahead of us in terms of their quality and reduction in cost, they have a main focus on preventative medicine. Obviously, if we can diagnose and treat symptoms, illnesses, diseases earlier, we're going to be more successful with the healthcare quality and success in treating that particular ailment. And the costs are going to be greatly reduced by catching it earlier in the cycle of that problem. We have to find basically a system that will allow us to have checkups and exams. We need to focus on proper diets, healthier lifestyles, because in the United States we have great technology, but horrible health habits, and that also contributes. There's numerous problems that are creating this, but I think everyone, whether they agree with Obamacare or not, everyone agrees we must do something, because the facts speak for themselves. We've gone from #1 in quality to 37th and dropping, and worse in certain really important categories. We have a very unhealthy lifestyle, a very unhealthy health system, yet our health care costs more than any other nation on planet Earth. So we must do something. Is Obama the answer? Obamacare the answer? Well, tomorrow, in the next section, in part 2, we'll get into whether that actually helps or makes it worse, or both. And on the third section, we'll get into, is it constitutional? Thanks very much for watching the Leo Dotson Show. You may now join your regularly scheduled TV propaganda and media mind control already in progress.